Hello everyone, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. I wanted to take a moment to explain to you what CardioRenal Syndrome means. It's the simultaneous occurrence of disease and pathology in the kidneys as well as the heart. In certain types, it's divided into 5 types. In certain types, the cardiovascular disease comes first and then renal afterwards. In other types, renal dysfunction comes first and then cardiovascular disease follows. And the acuteness versus the chronicity of it determines further between the types. So I hope that makes sense. I'll explain to you some of the other features of this. So now, to completely understand this, it's important to understand that number 1 and number 3, these are considered sharp acute. For instance, type 1 is sharp acute cardiac dysfunction. So these are acute, type 1. And then type 3 is acute. So it's 3 is sharp decline in renal function that results in acute reduction in cardiac function. So things like shock or a cardiac tamponade can lead to sharp declines in cardiac function. Also injury maybe to the kidney. So type 2, 4, and 5, these are distinct in that they are chronic. So 2 and 4 definitely are chronic, and chronic cardiac dysfunction that results in a sustained reduction in renal function. So you might have a GFR of about 60, but then gradually this GFR goes down, and a lot of times GFR is not very accurate in truly understanding where the nephron is functioning at. But that's a discussion for another topic. For now, it's important to understand the chronicity. So type 5 is a systemic disease that results in both cardiac and renal dysfunction. So we don't know which one followed which one, kind of like the chicken or the egg debate. So anyway, according to the 2007, and I actually wrote a dissertation about 10 years ago, and in that, of course, this was part of the study that I looked at, and this was the ADHERE database, and in that 2007 report, 118,465 individuals were admitted with acutely decompensated heart failure. So this just goes into the type 1 and the RAS activation, so renin-angiotensin-aldosterone system, and activates the sympathetic nervous syndrome. And then history and physical. The patient's history and physical can help clinicians to differentiate between acute and chronic decompensation. So that's how you understand, like for instance, jugular venous pressure, that's something. Generalized swelling with edema with third spacing, presenting at pleural effusion, ascites, or peripheral edema. Crackles or rails on lung auscultation. Patients may also demonstrate manifestations of decreased cardiac output. So all of these things, kind of like heart failure, was experienced with these individuals. So the damage in one disease leads to the other. First in mind, sometimes if the kidney is truly the causative agent and where it's coming from. So this is a very good article for if you're looking to learn about CRS, cardiorrenal syndrome. Again, something I've been familiar with. I wrote a dissertation and presented some of the findings as well. Thank you for listening.